Hi, it's Zoe here from Exercise Therapy. Thanks for joining me today. So we're going to have a little chat and do some exercises relating to the pelvic floor. So I work with clients, both male and female, with pelvic floor issues. And I do work with Ipswich Hospital, working with gentlemen who are recovering from prostate cancer, especially those who've had surgery or radiotherapy. Pelvic floor exercises are extremely important, both in terms of maintaining continence, but also just for keeping your lower back nice and stable, keeping your hips stable as well. So in terms of pelvic floor exercises, either you can do this seated on the floor, or if you prefer onto a chair, a firm chair definitely is better. And when we're doing a basic pelvic floor exercise, which I call a Kegel exercise, we're thinking about stopping yourself from urinating. So stop yourself from having a wee mid-flow. Don't ever do this when you're actually going to the toilet, okay? Just doing it in terms of doing the exercise. So sit yourself up nice and tall. Make sure you're up onto your sit bones. When we are slouched over like this, the pelvis falls underneath, and the pelvis isn't in a good position then to fire up those muscles. So bring yourself up onto your sit bones. Now imagine you're having a wee. Stop that flow in a mid-flow and think about pulling up those muscles for a count of 4. Make sure you breathe. So draw them up for a count of 4, hold and breathe. And then release those muscles for a count of 4. The going down is harder than the going up. Releasing them slowly is much more difficult than pulling them up in the first place. So if you don't quite get to 4 on the way down, then please don't worry. With practice, you will. So do that with me. So nice and tall for me. Relax the shoulders. Sit on your sit bones, either on the floor or on a chair. Absolutely fine. And think about stopping your wee mid-flow and pulling up 1, 2, 3, 4, breathe, and then down 1, 2, 3, 4. Now give me 4 quick squeeze releases. So squeeze the muscles tight and let go. And again, squeeze the muscles tight and let go. And again, squeeze and let go. And last one, squeeze and let go. So that is a Kegel exercise. Now, in a traditional Kegel exercise, we go for a count of 8. So that's quite challenging. So I suggest start with a count of 4 and then build that time up that you're pulling up the pelvic floor. Okay, so there's your basic exercise. Now, in terms of other exercises you can do, because it's more than just the pelvic floor muscles. So I'm going to give you a couple of other little exercises which are pelvic floor based, but also working in the muscles around the pelvic floor. Now here I've got a Pilates ball. This is a 7-inch ball. They're available on my website, exercisetherapyonline.com. I use these a lot for pelvic floor exercises, but also for lower back, upper back exercises. They're a great little bit of equipment to have, and obviously not too big. So I'm going to do a little exercise with this. So I'm going to bring myself onto my mat. Now, if you're not great from getting up and down from the floor and you want to do this on your bed, absolutely fine. So I'm just going to bring myself down and I'm going to place the ball between the knees. I'm going to relax my shoulders, feet nice and comfortable. Now think about engaging your pelvic floor. So imagine you're having a wee, so stop yourself from having a wee, and I would go to about 50%. So go to 2 rather than 4. Keep the ribs down for me, and now press your knees into the ball and hold and breathe. Good. Now relax the knees, but don't let go of the pelvic floor, and now slowly come down to 0. So do that again. So stop yourself from having a wee and pull it up for a count of 1, 2, hold, so about 50%. Now squeeze your knees, engage these inside thigh muscles, hold and breathe. Now relax the knees, but don't relax the pelvic floor. That's quite challenging. And then let go. Let's do one more with me. So go up to the floor number 2. Good, squeeze the knees against the ball, hold that pelvic floor, breathe, let go of the knees, and then let go of the pelvic floor. Good, well done, really nice exercise. We can also work into a little bridge, which is quite nice for the abdominals, for the glutes, and also for the lower back. You don't necessarily need to isolate the pelvic floor, but you can if you feel you can. So hands down for me. A little engagement with the pelvic floor to start. Squeeze the knees just gently against the ball. You can do this exercise without the ball. Now tuck your pelvis towards you so you flatten your back into the floor, and then gently peel your bottom off. Press those knees a little bit deeper if you can. Feel your glutes now switching on as well. It's your buttocks. And then gently roll the back down to the mat or to your bed. Good, release the knees and then let the pelvis come into neutral. So should we try that again? So engage the pelvic floor, squeeze the knees, tuck your pelvis up towards you slightly, and then just roll your bottom. That's as far as you kind of need to go. Keep that squeeze on the knees though. Breathe, and then roll that lower back down. Keep squeezing the knees. Release the knees and relax the pelvic floor. One more for me. So engage the pelvic floor, squeeze the knees, tuck your tailbone slightly to the ceiling, roll your bottom just off the floor, keep squeezing those knees. Breathe, lower back, roll it down. Good, release the knees, release the pelvis. Now you can, if you don't have a ball, do this at home, place a cushion between the knees and it's the same thing. So the ball is better, you get a better squeeze. If you haven't got a ball, you can use a cushion. Okay, so I'm going to turn onto my side and gently bring myself up. So I'm going to be sharing some more videos about pelvic floor, so watch this space. I hope you found today's exercises useful and I hope to see you soon.